Well, Dr. Beck, we talked a fair amount, a little bit about physical therapy and, that it helps, of course, for current injuries and before one gets under the knife. Give us some very specific illnesses, symptoms, pains for which people do come to a physical therapist.
Mm-hmm. Well, as a physical medicine rehab specialist, I see people with a variety of muscle and joint complaints. We consider ourselves musculoskeletal medicine specialists. And so we see a variety of conditions, and basically starting at the top and going down, I can give you a few of those. For example, one of the commonest conditions I see is neck strain or neck pain. All of us sitting in front of computers and driving cars and things these days, we all have neck pain. And unless the pain is coming from a ruptured disc or a damaged nerve, that condition responds beautifully to physical therapy. Moving on down, shoulder issues, again, working on computers, doing the 21st century type of activities can lead to a lot of pain in the upper extremities, that being the arms and the shoulders and the hands, where you get strain and overuse syndromes, particularly in the tendons and muscles. And those conditions also respond beautifully to physical therapy because, again, physical therapy is addressing an underlying weakness, an underlying inflexibility, or an underlying injury in the muscle and soft tissue. So those conditions do quite well. Moving on, even conditions like carpal tunnel syndrome, which does involve nerves but also involves swollen tendons and tissue in the wrist joint, can respond to exercise and therapeutic exercise by your physical therapist. Other conditions, back pain, everybody has it. It's just it's a condition of the human person. We all have back pain. Some people say it comes from walking on two legs instead of four. But back pain is very, very common. And one of the things we know about back pain is that the stronger and more flexible your back is, the better it is. And the less incidence of back pain you have, and the less occurrences of back pain you have. So you don't have to worry so much every time you lean over to pick something up that you're going to hurt yourself. So back pain is another condition that responds quite well to physical therapy. And again, I think everybody's had an episode of back pain, and they know what it's about. And so when you do have back pain, think about physical therapy. Moving down, another condition I see a lot in people, particularly when they have tight hamstrings and tight tissue in the hips, is bursitis of the hips, and that can be extremely painful. People frequently come in and tell me they can't stand to lay on their side at night, their hips hurt, they can't move, they can't do things. And this condition, we co-treat with physical therapists. They work from the therapeutic exercise in. They also use hot packs and ultrasound and modalities to help decrease the inflammation. And in my office, I also assist in the recovery with things such as steroid injections into the hips and therapeutic exercise as well. So another condition that works quite well. Knee pain is another common condition I see. A lot of people have pain, particularly in their kneecaps, and this frequently comes from weak quadriceps muscles, not your thigh muscles. And people a lot of times come in and talk about, gosh, my knees just kill me when I sit for a long time in a movie theater or when I go up and down stairs. And this condition is basically the result of weak muscles. So how do you get the muscles stronger? Physical therapy. That's the ticket. Moving on down the leg, the other condition we see a lot of is weak ankles. And if you have weak ankles, what happens? You strain them, you turn them. Every time you get on uneven territory or uneven ground, you're at high risk for straining your ankles. And again, this is a condition that the only way you're going to treat that to fix the original problem is through therapeutic exercise. That is strengthening the muscles that support your ankles, strengthening the muscles that support your knees. So those are some of the most common conditions that I see that respond very well to physical therapy. And so you should really keep therapy in mind first when you're looking for a way to get rid of these issues.
Wow. Well, that is definitely pretty much from head to toe here.
Head to toe, yep.
And I can see that. I can see that. I have probably twisted my ankle. Usually just walking. One time I remember I was playing tennis and I twisted it, and that one I kind of wrote off as you run, but a couple other times in my life, just walking the slightest little things, and to a certain degree, once you have done that once, you threaten it. That stuff hurts.
Oh yeah.
Yeah, and And I know my wife did it once. And again, so they're very specific. If you just then go and exercise, you probably won't fix the right muscle, because I think you said something there, in terms of knee pain. Who would have, what muscle was that you said is weak because you have knee pain?
The technical name is the vastus medialis, but it's really your quadricep or thigh muscle.
So,
but it's a very specific part of the muscle that you have to work on.
Right. I mean, who would think that? And how would you know that, just so to say, getting overall strong? So you may overall be another Arnold Schwarzenegger, but your knee hurts anyway because that one muscle wasn't part of your exercise. Yeah?
Yeah, that's what really happens. People, they try to do a lot of exercise, they overtrain the wrong muscles, they leave the right muscle weak, and so they don't hit the place they need to be working on. So this is where you really need a skilled physical therapist to come in, hone in on what the exact muscle weakness is that you need to address, and then address it. And oftentimes it takes very specific and very technical exercises to do that. So, for example, to train the knee muscle, you have to only extend your knee from a range of 0 to 30 degrees. So, if you go in and just do the exercise machines at the gym, you're not going to do it right. So you really have to work with somebody that knows what they're doing.
Well, I can see. I mean, different purposes, One time maybe you want to look mainly, and that's fine. You want to do that, you do that, but it probably doesn't help you with your arthritis, or with your tennis elbow or whatever it is you might have. And there's a particular muscle which needs to be promoted, just like there's a particular muscle to look like that which needs to be promoted. Yeah, I'm sure there's people out there very, very strong, and when they go like this, they don't look like Arnold, because that's not the muscle they promoted. Yeah?
Yeah, I think the condition you mentioned, tennis elbow, that's one I see almost daily. And I see this in very strong guys that work outside a lot, pipe fitters, people like this. And the problem is they've got a very specific muscle that's weak, and it is in the forearm region, but they're overcompensating using other muscles, and they need very specific exercise to address the muscle that is being affected. So, yeah, I see this kind of thing all the time, and particularly with conditions like tennis elbow, and people that are actually very fit. And so they need to get very specific exercise to address the underlying problem.
Well, that does it. That does it. This is very valuable information. Just realizing that there is probably a muscle which makes another part of your body hurting or not functioning well, and if you don't address it, that's like doing an operation in the wrong part of the body. It just doesn't do much good. All right.